surgeries performed for Crohn's and colitis?
So Crohn's and colitis are two different pathologies, and therefore they require different surgeries. Colitis tends to affect the whole of the large bowel, hence the word colitis, as in colon, and doesn't tend to affect the small bowel. So what that means is the surgery you perform on the colon for colitis is normally to remove the whole of the colon, called a colectomy. At the time of surgery, you make a decision about removing the rectum as well, but generally, surgery for colitis is called a colectomy, a total colectomy, which is removal of the whole colon, or a pan-proctocolectomy, which is the name for removing the colon and the rectum. Now, Crohn's disease is a different pathology completely. Crohn's disease can affect anywhere from the mouth to the anus. So therefore, you might need to perform surgery on anywhere along the alimentary canal. So the surgery you perform, we tend to do as little surgery as we can to remove as little of the bowel as possible, to preserve as much bowel, because a lot of patients with Crohn's disease will go on to have further surgery when further parts of the bowel are removed.
Is surgery a cure?
It is a cure for colitis, it is not a cure for Crohn's, and unfortunately it's as simple as that. So fortunately for those patients with colitis, yes, surgery is a cure. For those patients with Crohn's, no, it's not a cure.
Is there a difference in surgery for children and for adults?
There's a technical difference in size, but the principles of the surgery remain the same. You have a diseased area which has failed to respond to medical treatment, which needs to be removed to allow the patient to thrive.
Can surgery affect fertility?
On the whole, no. One would perhaps, in colitis, counsel patients about fertility because you operate in the pelvis. In the pelvis, there are nerves which supply the organs, which can be threatened during surgery. So in surgery which involves the pelvis, you would counsel patients about fertility, yes.
With a reversible stoma, how often do they actually reverse?
Well, one would like to say, if you're putting in place a reversible stoma, your reason for doing that is to rest the bowel, to allow it to heal, and then to reverse the stoma, to put the stoma back. So you'd like to be approaching 100% of stomas being reversed, if they are being put in place as what we call a defunctioning stoma, just a temporary stoma. If you're having a permanent stoma put in place, well then they're not reversed. But most of the time one would try and reverse a stoma, although saying that, with the help of stoma nurses and stoma care, we have many patients living totally normal lives with permanent stomas which cannot be reversed.
What is the likelihood of relapse post-surgery?
One would like to think in colitis, when we remove the colon, you asked me earlier, is that a cure? Well, the answer to that question is yes, and the relapse rate would therefore be 0, as long as the whole of the colon and rectum is removed. In Crohn's disease, unfortunately, depending on the age of the patient, the younger the patient, the earlier you perform surgery, the more likely in the future there'll be a relapse potentially requiring further surgery.
Has the rate of surgery reduced since newer medications have been more successful in treating IBD over the past few years? Absolutely.
Surgery we try and leave as a little bit of as a last resort, especially in Crohn's disease. The medical therapies have improved significantly, allowing us to wait longer for surgery and even avoid surgery. And the same with colitis. The thing about colitis we have to remember is that you have to keep the bowel under regular observation.
How has surgery changed over the years?
It's changed dramatically. Surgery has become less and less invasive. We make smaller cuts to achieve the same end point. Minimally invasive surgery, keyhole surgery, i.e. laparoscopic surgery, where we do the same operation but through very small cuts, with less scar tissue being formed and a quicker recovery. So it's changed dramatically over the last decade to 15 years.
Are surgeons keen to always do surgery, or do they try and avoid it if they can?
Depends on the personality of the surgeon, but the general consensus is you try and avoid surgery in patients with Crohn's disease if you can, until medical treatment fails. And in colitis, there's always a discussion. The decisions aren't made by the surgeon independently. In this day and age, the other thing which has really improved patient care is something called a multidisciplinary team approach. And what this means is you don't have anyone in isolation making decisions on the patient's care. You have a team of people, which would involve a surgeon, a gastroenterologist who's a specialist in treating colitis and Crohn's with medical therapy. You have people that look at all the scans, and you have people that look at biopsies. You also have the nurse specialists and the nutritionists, and a whole team of probably about 10, 15 people who work together to make a decision on what's the best strategy to treat these patients. So even if a surgeon felt that they wanted to operate, that goes up for a discussion with a panel, and everyone discusses what's best for the patient. So it's really not an independent decision, it's a multidisciplinary decision about when surgery is necessary.
Having performed many surgeries, is the overall feedback from patients positive, negative, or somewhere in between?
I'd like to say it's positive most of the time, and the reason for that is when you come to surgery, the reason these patients have come to surgery is because they've failed medical treatment and they've tried medical treatment, but they still have symptoms. By definition, the medical treatment hasn't worked. So they're normally very grateful for the surgery, and it can be life-changing. It can be life-changing, and it can change their quality of life, especially in patients with colitis and even in patients with Crohn's disease. Patients that have got symptoms, pain, frequency of going to the toilet, socially they're inhibited because of it. It can change their whole outlook on life. So in answer to your question, most are overall very, very satisfied, if not very happy.